Stephanie Bell Flint joins us now to talk about Diabetic Eye Awareness Month. And if you have questions, you can send them to the doctors at WLBT.com.
Thank you, Maggie. Joining us is Dr. Kevin Kosek. He is with the Eye Group of Mississippi. And Dr. Kosek, thank you so much for joining us.
Thank you.
I don't know this firsthand, but I know that I've been in plenty of ophthalmologist offices with patients who have diabetes, and their vision gives them fits.
That's right. Diabetes, particularly eye disease, is one of the most common complications facing patients with diabetes. There are nearly 29 million people in the United States who have diabetes, and almost a third of them don't know they have the disease, so they're at risk of severe vision loss.
Now, my grandmother, as I was telling you, lost her eyesight to diabetes. She remained independent, but it was amazing to watch the progression. I was very young, I guess about 9 or 10 years old, but it is a progressive type of thing. Can you stop it once you notice there's a problem?
That's correct, and you know there are a number of complications associated with diabetes, but the most serious is damage to the retina, which is where all the light-sensitive tissue is in the back part of the eye. That can be irreversible, so early detection and treatment is the key. And you know, we like to see those patients and get screened as soon as the diagnosis of diabetes is made.
And that's the inside of an eyeball
that's
you're
the
looking
inside.
at, by the way.
That's not a real eyeball, but
That'd be a giant eyeball.
That'd be a giant eyeball.
So when you go to the eye doctor and they shine the little magnifying glass, I guess is what you call it, is that what they're looking for? They're looking for the retina, the back of the eye?
That's correct. That's correct. So we actually dilate the pupil so we can see inside with the light, and we use a magnifying lens and we can inspect these blood vessels, and if we catch the disease very early, then we can just work with the internist or endocrinologist or family doctor and recommend tightening up the blood sugar control. If the disease progresses, it becomes more difficult to treat. We have to use medications, laser surgery, even incisional surgery in severe cases.
All right, well, is this going to be a problem for almost everybody with diabetes? And do you have to have like really bad diabetes, or is it mild diabetes? I mean, who's going to get hit by this?
That's a good question, and there are studies underway to research the genetics of it and see who's more susceptible to it. But for now, the American Diabetes Association would recommend everyone get screened at least once a year, and more frequently if there are any findings there.
What are some of the other problems with their eyes that diabetics had? I know my grandmother also had cataracts.
That's correct. Yeah, cataracts are very common with diabetes. That's an opacity in the lens of the eye. Also, glaucoma is associated, and there are even some studies now associating dry eye with diabetes. So a lot of associations.
I'm curious to know exactly how diabetes affects the retina. I mean, what happens in your body that it goes to your retina or your cells or whatever and causes damage? I don't understand.
I like to explain to the patients that high blood sugar, you can think of it like sand traveling through a pipe. The more sand in the pipe, the higher the blood sugar, the more the lining of the pipe will wear over time, which can cause it to leak. And when a blood vessel leaks in the eye, not only does that cause damage, but a leaky blood vessel will actually send out a distress signal into the eye, telling it to grow new blood vessels. And these new blood vessels are not healthy and normal. They are very invasive. They can cause the eye pressure to run high, they can leak, they can cause bleeding in the retina, and so that's kind of the cascade of events.
So can you get glaucoma too from diabetes?
You can. The area in the front of the eye where the fluid likes to drain out can be obstructed with these abnormal blood vessels, and that's called neovascular glaucoma, and that's one of the findings of sort of late-stage diabetic eye disease.
Now, I get checked every year for glaucoma.
Yeah, I do too, and cataracts as well. So the main thing is early detection is key.
That's right. Early detection is key. You know, we recommend anyone with diabetes, or if they've been told they have pre-diabetes, call the Eye Group of Mississippi. Visit our website. We're at igroupms.com. We have information there. You know, we can make appointments, we can do screenings, but you know, we want to get those patients coming in. We don't want people sitting at home and putting this off.
Now, when it comes to family history, when you think about, my dad is also diabetic, and I have 2 siblings who already are being treated with eye drops because of the pressure in their eyes. So is the family history that strong that you have to really be aware of what's happening with your eyes, and because I know I get checked every single year.
That's right. You know, family history is a significant risk factor for glaucoma, but for diabetic retinopathy, it looks like it probably is a component, and that's part of this huge study that's underway right now, right here in Jackson, trying to work out the genetics. So we could do genetic testing and find out who's at the highest risk, and then adjust the screening measures accordingly.
I say enroll her now.
Thanks, Stephanie.
Come on in.
You need to get some contacts. Not contacts, like written down contacts.
Thank you so much.
Yes, thank you for having me. I appreciate it.
Well,